Text of the DO letter of Thiru M.K. Stalin, Honorable Chief Minister of Tamil Nadu, addressed to Thiru Narendra Modi, Honorable Prime Minister of India, requested to instruct the Union Ministry of Health and Family Welfare to keep the notification issued by the National Medical Commission (NMC) in abeyance. I wish to draw your kind attention to the regressive scenario created by the recent notification issued by the National Medical Commission to restrict the opening of new medical colleges. It has been notified by the NMC that after academic year 2023-2024, the letter of permission for starting new medical colleges shall be issued only for an annual intake capacity of 50 to 100 to 150 seats, provided that the medical college shall follow the ratio of 100 MBBS seats for 10 lakh population in that state or union territory. This is a direct encroachment on the rights of all state governments and penalization of states who have invested more in their public health infrastructure over these years. Progressive states like Tamil Nadu have been strengthening their tertiary healthcare network for many decades. This has led to ample availability of doctors and nurses, which has manifested in their better performance in terms of various health indicators. Chennai has emerged as the healthcare capital of India. In both public and private sectors, our skilled medical professionals have been able to successfully serve not only the people of Tamil Nadu, but also of other states as well as other nations. This has generated huge demand for quality health services, and new institutions are absolutely necessary for us to cater to it in the future. The criterion proposed for such restriction, higher doctor population ratio at the state level as compared to the norms, is also not appropriate. Even when there is adequate availability of doctors at the state level, there are districts where the availability continues to be a persistent issue. This problem can be effectively addressed only by opening new medical colleges in such backward areas. Any restrictions on new medical colleges based on state level criteria will deprive these deserving districts of much needed tertiary institutions. I would also like to point out the fact that in states like Tamil Nadu, which have higher doctor population ratio, such high availability of doctors has been achieved predominantly due to investments made by state governments and private sector and not by investments made by the union government. We have been continuously urging that the union government needs to contribute more, but projects like AIIMS, Madurai area to take off. Given this situation, a restriction on new institutions will completely eliminate any chance of Tamil Nadu getting new investments in health sector by the union government in future. In its recent judgment, Civil Appeal number 6681 of 2002, the Honorable Supreme Court has also held that executive instructions could not impose reasonable restrictions on the fundamental right to establish educational institutions under Article 19(1)(g) of the Constitution of India. Thus, the above NLC notification may also be legally untenable. Considering all the above issues, I request you to instruct the Union Ministry of Health and Family Welfare to keep this notification in abeyance and initiate a consultative process with the state governments on the steps to address this issue. I'm Meera Nair and you're watching India Today SoSouth.